Yeah, so the COVID news keeps changing. And
Yep,
recently,
every day.
there, yeah, all the time. And recently, some information was released, where public health experts were explaining why they were against shutdowns. Right
Mm.
now, Trump has been saying to open up the country for like some weeks now, and Democrats have lost their minds about it, saying, "Oh my God, he doesn't care about people." He is going against his scientific community. He's going against healthcare professionals. So when this information came out, Shannon, I was actually quite surprised that you now have public health experts saying that lockdowns are actually, to a certain degree, counterproductive.
Yes. So I do agree that. So what they're saying is that a second wave of lockdowns is productive, and
True.
I agree with that. I think that shutting down the country again will not be as successful just because we already went through it once and we came out of it kind of, and people are not going to be receptive to the thought of having to do it again, even though I think that it'd be better. A second lockdown in the winter would actually not be as bad because people don't want to go outside anyway. But
that's an interesting point.
I kind of agree with that. Now, I don't think that that's the same thing as saying that the country should be open, like, but I don't think that we need to lock down completely. I just think that we need to be more careful in day-to-day life. Like, things don't need to be opening up to 75% capacity and like all this other stuff. I think we should keep it restricted, but it doesn't need to be completely shut down like how it was back in March.
Okay, so here's the thing. So basically, just for our audience, the World Health Organization were the ones saying that lockdowns might not necessarily be the answer, and basically, what people have to understand, lockdowns come with economic costs, right? So when you lock down a state, a city, a country, when you lock down, there are economic hardships that also cause issues that might be more detrimental to a community than the actual coronavirus. So the World Health Organization was coming from that perspective. Now, another point Shannon made earlier, lockdowns are useful when you need to gather yourself, right? That's what I read in the article. Meaning that if you're going to lock down, the main purpose of a lockdown is you have an incoming virus that you don't know how to deal with. You don't know how you want to execute a plan. And so what do? You lock down. Number one, this helps prevent the overrun of your health system. Number two, it gives you time to plan, right? Number three, it is the most effective solution in that exact moment to keeping people safe because you don't have any other plans laid out yet. And so lockdowns are never meant to be a long-term, solution to this problem. They're supposed to be used for a specific function. We didn't use them in some places the way they were intended to be used, right? So, for example, in New York City, when we locked down, I think it was late March, early April, something like that, around that time, when New York City locked down. Basically, we lock people down. We have the essential businesses open, so you can go and shop and buy your, things that you need. This kept people from interacting with each other, people from moving around, like they were earlier in earlier times. This helped keep the COVID deaths from rising to as high as what was predicted. Remember, Trump sent over that ship for us to use because it was estimated that we were going to get hit bad with the number of beds we would need and the ventilators that we were going to need. And luckily for us, we actually didn't use the ship that much, or the makeshift hospital that they built in Central Park.
Oh, I forgot about that hospital. Yeah.
So we didn't really need and I think was it the Jacoby Center or something else. Am I mixing that up?
Oh yeah, the Javits Center.
Javits Center, thank you, Shannon. Javits
I'm like,
Center,
what are you talking about?
Jacoby Center. So the Javits Center. We built a bunch of these makeshift hospitals because we thought we were going to get overrun with people needing serious medical attention. Luckily for us, that didn't happen, right? But the lockdown gave us time to strategize, keep people in place while you get a game plan. Other states didn't do that.
Nope.
They just locked
Florida
down.
didn't do it. That's for sure.
I don't think Florida ever locked down.
They didn't.
They closed like businesses, but they never locked down as far as, don't leave your house for,
Yeah.
A bunch of Republican states didn't lock down because they didn't believe in it. But here's the thing. I disagree with them for not locking down, but at the same time, I do think Democrats are dismissing how much lockdowns hurt people.
Mm-hmm.
Now, they could be doing this on purpose because they see that a bad economy hurts Trump, and so they don't care that people are struggling. They just want to get Trump out, and maybe they'll change their tune post-election. We don't put it past them. They're politicians, like Republicans are politicians. But I just think the public needs to know that, the health officials are no longer promoting lockdowns.
Yeah.
They're promoting opening up as much as you can safely. So having people wear masks all the time, especially when they're indoors, right? Limiting capacity where applicable, right? So don't have people jam-packed into bars. Don't have people jam-packed into restaurants. No, you want there to be more space, less people, so that less people get sick. You don't want any clusters, right? So basically, be smart, follow the science, but also be smart and try as much as possible to create an environment where people can go out there and work and create a living and get out the house. Because that comes with depression and anxiety. And I don't know if you're looking at the reports about, I think it's like a quarter of Americans contemplated suicide during these lockdowns. It was really bad.
It was bad. It was. And a second lockdown is certainly not the answer at all. But I mean, I don't really know because I don't know what's going to happen if hopefully cases don't go up to a point where it's going to get out of control again. But
well, cases are going to go up, but the interesting thing is, if you
I mean to a point where it'll be bad, it's going to weigh on the hospital system and stuff like that.
Well, here's the thing: flu season is coming, and we're going to have coronavirus around. Something to watch though is, in theory, the steps that we take to curb the coronavirus should keep the flu cases down as well, right?
Technically speaking, yes. Also, you should get your flu shot. Just saying.
Look, man, I have not gotten a flu in years. In years.
I know. I'm just saying. So if you normally don't partake in the flu shot, sure, fine, whatever. I've gotten a flu shot every year since I was born, whatever. But I'm not telling you what to do. But I'm just saying this year, I feel like it is particularly important to get a flu shot because of the coronavirus. So I'm just saying.
No, she's right. Yeah. Number one, when you get a flu shot, it helps prevent you from catching the flu. But even if you get the flu, it lessens the severity of the flu, whether it's how sick you get or the duration you are sick. So those are the upsides. I don't have any logical reason why I don't get the flu shot. I just don't. I don't have any excuse. I'm not an anti-vaxxer. I'm not an anti-vax. I'm not one of those people. I'm not anti-vaccine. Yes. I believe in vaccines. I believe in science. I believe in medicine. For some reason, I just refuse to get the flu shot. I don't have no excuse. There's no excuse for my behavior. Don't be like me. Be like Shannon.
You're not gonna get it? Wait, what? What?
I said, don't be like me. Be like you.
Oh, okay, good. So you're not gonna get the flu shot this year either?
No, absolutely not.
Okay, well, I don't think that you should listen to Jabia. I think you should get a flu shot this year.
I agree with Shannon.
If you don't normally get it, I just feel like this is an important year to get.
Totally agree with Shannon.
Don't be like Jabia then.
Don't be like me. Don't be like Shannon. Now, for those of you, for the small minority of you, you know who you are. That is going to have adverse effects of this thing. Then blame Shannon. Don't blame me.
Put an effect on your voice?
Yes, I did. Sorry.
Oh, I'm like, what is that?
Shannon was looking around like. You thought that was God, Shannon? You thought you heard God? Thought you heard the
I was
Almighty?
just making sure nothing was wrong with your mic. I'm like, what? Like, what is happening? Okay.
Yeah, but if you have an adverse effect,
you're not being a good role model, Jabia, to the people that are listening to you.
I totally agree. I'm just saying, if you have adverse effects from because look, 0.0001% of people are, they're going to have some type of adverse reaction to the vaccine. For those of you that are in that bucket, The hell?
What happened?
Nothing. For those of you who do have adverse effects, blame Shannon.